Thank you, Bhavini, for inviting me to speak on this very important topic, and hopefully I'll be able to inform everyone about what I actually am working on. My name's Sheena George. I'm a consultant ophthalmologist with over 30 years experience in eye healthcare. I specialize in diabetic retinopathy. That means changes due to diabetes at the back of the eyes and other conditions that can affect the retina, which is the camera film of the eye. So obviously for today's webinar, I'm talking about the changes that can occur to the eyes if you are diabetic. I'm sure that you all know there are two main types of diabetic diabetes. There's the type 1 and the type 2. The type 1, in essence, is when you cannot produce insulin, which helps regulate blood sugar, due to damage to the cells in your pancreas that normally secrete this hormone. And type 2 diabetes tends to occur later in life, though there are more common people in their late teens or early 20s getting type 2 diabetes, where you are still able to produce insulin, but it doesn't work as effectively as in those without diabetes. So I'd like to just go over the scale of the problem that we have in the UK, and specifically the changes that occur in the eyes, how it can be identified, and the treatment that can be offered to help preserve the vision, and obviously how we can try and control and maintain our the blood sugars in diabetes to help reduce these complications. Now, as you know, diabetes affects the whole of the body, and I'm sure a lot of you will know, it can affect the kidneys, it can make you more prone to heart attacks or strokes. But as I said, I'm going to talk about how it can affect the eyes. So in the UK, there are nearly 4 million people over the age of 12 years old with diabetes, either type 1 or type 2. And it was noted, it has been for many years, that the changes due to diabetes was the commonest cause of problems with the eyesight in the working age population, not just in the UK, but around the world. So the UK wanted to try and devise a system on how to identify those who needed treatment for their eyes due to diabetic changes and those who could just be monitored. So in the past, everybody with diabetes used to be seen either by the optician or in the hospital. But we found that this was not sustainable, because obviously there's only a certain amount of capacity or clinic appointments that the hospitals can offer, as well as what the optometrist can offer. So in 2003, through the digital delivery of strategy for the National Service Framework for Diabetes, it was decided to set up a national diabetic eye screening program. And the 4 UK nations, which is Wales, England, Scotland, and Northern Ireland, were one of the first in the world to actually implement this diabetic eye screening program. It's actually quite revolutionary. And by 2008, there were these local diabetic eye screening programs around the whole country. And so what these programs were tasked to do is to actually call people, anybody with diabetes, to have photographs taken of their eyes every year. Now, people with diabetes would be identified by the GP from their patient lists and sent to the diabetic eye screening programs. And there would be obviously an administrative team sending out appointments every year, asking people to come to have their eyes photographed. And this has taken a lot. I mean, it took about 5 years to set up, and a lot of countries still do not have this type of screening program. But we were very lucky in that the government realized the importance of making sure that people with diabetes were able to maintain their vision and not be affected significantly adversely. So, so at the moment, we have about a 10% increase in people needing photos of their eyes every year, which is a reflection of the incidence of diabetes going up every year. And so that is another important factor that is very topical at the moment, how to try and not just control your diabetes, especially the people with type 2 diabetes. Generally, I mean, I can't speak for GPs, but I know in a lot of GP practices that if you have a slightly raised blood sugar on your blood tests, on routine blood tests, it will be discussed with you about going on specific programs to try and reverse and get the blood sugar under control again, because it wasn't thought for many years that you could do anything about diabetes if you developed it, apart from going on tablets. But there have been lots of research studies and actually programs on the TV, especially on the BBC, showing how you can reverse diabetes and get your blood sugars under control, back to normal, especially if you're within 6 years of being diagnosed as a type 2 diabetic. Unfortunately, obviously type 1 diabetics, that cannot be done because there is no production of insulin. But in type 2 diabetics, with a change in your lifestyle and being careful with what you eat, it is possible to reverse diabetes. And I think that is the message that needs to go out to as many people as possible. If you have type 2 diabetes and you focus on trying to get it reversed, you can actually do it. Okay? That is really, really important. And myself, I have a very strong family history of diabetes. And because I monitored my blood sugars, I became pre-diabetic at least 4 times in the last 5 years, and I was able to reverse it by altering my diet and being careful with what I actually ate. I'm not saying that you need to restrict yourself in any particular food groups, but you have to, your GP will have a practice nurse who is specializing in diabetes, who will be able to give you advice on how to manage through your diet and your lifestyle, on how to manage and hopefully make your diabetic control better and even to reverse it. So going on to diabetic retinopathy, what happens in the blood vessels that supply the camera film of the eye, the retina, the relatively high blood sugars are essentially not healthy for those blood vessels. So what happens is that the cells that make up the walls of the blood vessels get damaged, which allows the constituents of the blood to leak out into the retina and cause buildup of fluid and shortage of oxygen getting to the retina. Now, the retina is an extension of the brain, and as you may or may not know, but the brain needs a lot of oxygen and energy. So the retina, the camera film of the eye, is an extension of the brain, and so it also needs a lot of oxygen. And the high blood sugars can damage the blood vessels that supply the oxygen to the retina. So if you get leakage of fluid into the central part of the retina, the area that you use to see the finest detail, that can cause blurring of your vision. And also, if there isn't enough oxygen getting to the retina, the body senses that and it starts producing new blood vessels to try and supply the oxygen that it is being starved of. And those are the two main reasons why you can get problems with vision from diabetes. Now, there are numerous treatments, which I can go into if you want more details about that in the Q&A session. But there are treatments for both of these complications that occur. But the main message is that it's important that it's spotted early. And that is why the diabetic eye screening is so relevant. Because if you get called for an appointment, please do not decline the appointment and not go. It is really, really important that the sooner we can catch early changes, the less treatment that you will need for your eyes. One of the treatments which my patients do not like is injections of medicine into the white of the eye. And obviously, you know, when everyone hears that that's the way to treat this particular complication of diabetes in the eye, you would naturally get scared. But it's a very not, I can't say pain-free, but minimal pain. And a lot of people think it's better than going to the dentist. And obviously, if it saves your vision, then you'd want to come to have your treatment. But my message is to try and get to a point where you don't need to come for that treatment and to prevent that from happening. Yeah, the other type of treatment in general that we provide is laser treatment, both for the fluid that collects in the center of the retina and for the new vessels that can develop on the surface of the retina. If those new vessels are allowed to develop, because they're much more fragile than the existing blood vessels, they can bleed very easily, filling the whole eyeball with blood. And if that happens, you know, you lose your vision instantly. So the whole point of the laser treatment is to try and prevent those new blood vessels from growing, or if you have got them growing, to get them to regress or go away. So both those are the two mainstays of treatment. And the key is to try and get to an eye doctor as early as possible. And so that, as I said, is the main reason why the diabetic eye screening program was set up by the government via the NHS. And they have very specific targets. There are, you know, they look to see how many people will take up the offer of an appointment. And if the appointments aren't acted on, then there will be, the admin team will look to see why. You might get a phone call to ask you if you can come for your appointment, or if there's any particular reason why you don't want to come. Some people would like to go privately and have their eyes looked at by an eye doctor specifically, whereas these photographs that are taken are reviewed by a technician who's been trained in looking at the specific signs on the photo, the little marks on the photos that can tell them if there's a problem. So they work to very strict protocols. And if they see changes either in the center of the retina, or if they see new vessels growing, they will send them straight up to the eye clinic or the eye hospital for either treatment, or it may just need a bit closer monitoring. Okay. The other thing I'd like to say is that, you know, there's a lot of help, not just from your GP or the practice nurse or even the hospital, but there are a lot of patient groups. I am actually a professional trustee of the Macular Society, which is a society that you probably haven't heard of, but it's a charity that helps people deal with visual problems if they have any diseases of the macula, which is the center of the retina. And the center of the retina is affected in diabetes. So there is a helpline you can ring and ask any questions, and you'll always get an answer back. If they can't answer you immediately, they will get back to you with the answer. Right. Is there anything else, Bhavani, that I need to cover now, or can I do that with can we let Clive come in and
yeah, that's fine. We can invite
Clive to answer questions.
Yeah, we can invite Clive in, and then we can jump to Q&A and then go into specifics at that point. Clive, we don't normally have a guest speaker, but today we're gonna Clive will share his story and his journey actually of developing diabetic retinopathy. Clive, do you want to come in now?
Yes, I can.
Thank you.
Yes. Yes, my name's Clive. Sorry. I've got macular degeneration caused by diabetes. I suppose actually my journey actually begins before my diagnosis in a funny way. In 2011, when I was at work one evening, I saw funny shapes on my computer screen. I wondered what it was. I thought, well, it's just because I've been working all day on looking at this screen. But in fact, I'm pretty convinced that was the beginning of my sight problems. So I had I kept on getting these letters from the retinopathy people saying, yeah, we need to look at your eyes. And I went there dutifully every year as soon as I sent it. And unfortunately, I kept on getting these letters saying that there have been changes to the back of your eye, but you don't need to worry. So as it was a medical letter, I thought, well, that's fine. I won't worry about it then. And then I went to change my spectacles. I think this was in July of 2017. And the ophthalmologist looked at my eyes and said, I think you need to get to a consultant as soon as possible. And so by October of 2017, I was receiving help, and they were looking at my eyes, and ever since then, I'd say my vision's going down quite steadily. I can see in my right eye because they gave it a laser treatment quite early on, which stabilised things quite well. But my left eye, I couldn't do laser, and I've got at the moment my acuity, which is that that chart that you have in opticians. Well, my acuity is 6/60, so it means I'm now at a threshold when I could and should have some help from the low visibility team. Although at the moment they're playing hard to get because they say, well, yeah, but you're not 660 in the other eye. So I don't know what that means. But anyway, so that's my story. I would think that I've been quite lucky with my treatments. Like, it never stopped during the pandemic, apart from a two month hiatus. So I've been quite lucky with ophthalmic consultants, and I even have Sunday afternoon sessions. Didn't even know that they worked on Sundays. So it's been quite good. And I've what I would say to people everywhere is that, for goodness sake, get your eyes checked. If you're not having it checked already, get your eyes checked, because it's important. And if they catch it too late, then I think that your chances of stabilising the progressive degree of your eyes, it gets harder. Is all I'm going to say. Well, unfortunately, and I was reminded of this afternoon because I spoke to my old diabetic nurse this afternoon by coincidence. She's back at work apparently. Apparently the NHS golden pension isn't that golden apparently, but I owe my entire that I've got any vision at all and any life at all is down to her. She sat me down one day and said, "Look, Clive, you've got to do this. You're dining out in the Last Chance Saloon, and you'll be dead in a year." And she wasn't far wrong. I was in a pretty bad state because I wasn't really controlling my diabetes. But I did. She gave me a book. Actually, it's the only time I've ever been given a book as a prescription. Right? She said, "You got to read this book," and she gave it to me, and it was Michael Mosley's Low Blood Sugar Diet, and I've stuck to that ever since. My HB1C came back today, and I'm 43, so that's not bad. Not bad for someone who's had diabetes for at least 26 years now. So I'm quite, what I'm saying is to you all, if you're a bit scared of injections, don't worry, because Sheena was quite right. It's only like a little scratch, and sometimes I don't even feel that, to be honest. So, but it does have terrible consequences if you ignore having your eyes tested, because it gets harder. The longer it goes on, and without you doing much about it, or if anything about it, the worse it will be. So that's what I would say. So I shall finish there, and you can ask me questions afterwards.